Hey there, it's Lowell Wild Jr. Last week I told you about our recent FABI Mastermind meeting where Chris, Matt, and I were on the video. We talked about all the great breakthroughs that we have when we work with our mastermind members. One of the things that we did during this most recent meeting is we talked about clinical protocols. And in particular, we went over heel pain from beginning to end and how to properly and comprehensively take care of heel pain. And it was great. We had 30 doctors from around the country in the room, and we talked about and somewhat debated is how do we take care of heel pain from the first visit to the second visit, when to add in different types of treatments, whether it be orthotics or cortisone injections or shockwave therapy or night splints or surgery or amniotic injections, all of those different things we talked about and we debated. And ultimately, we came to somewhat of a consensus where we all felt like this is the best way to approach heel pain. Now, certainly, it wasn't like you have to go boom, boom, boom. It was guardrails of you can pick within these areas of what you should do. But one of the real big consensuses that we came up with, which was comprehensive care from the very beginning, is the best way to approach heel pain. And I'll tell you, for me in my personal practice, I have found that whether it be heel pain or anything else, doing one thing at a time rarely yields the results that we want for our patients. It draws out the time of care and often doesn't get people to the final outcome that they desire. So I will get second opinions coming into me from doctors outside of our organization or really even within our organization. And what I commonly see is that doctors often only do one or two things at a time and don't go for the most comprehensive care that will help get people better faster. And for sure, look, you might end up saving a little bit of money by going one thing at a time, but in the big picture of things, patients desire to get better, even if it costs a little bit more. And it's really not about expense. This is about getting people better. So to that end, this week, we're having the Wild Foot and Ankle annual doctor's retreat. And for the first time in 3 years, we're in person and we're going through a couple of different treatment protocols. And we're first going through the evidence-based medicine about these particular problems. And then we're going to open it up to the group and say, hey, how do you treat these problems? And what my desire is that everybody's going to walk away with a standard protocol that will be universal within our organization, even though we already have that. But people are going to come away and say, this is the way I'm going to treat these different problems. And I'm going to be thinking about that each and every time. And so for you at home and in your clinic and with your team, you should have protocols that are comprehensive in care that are going to get your patients better the quickest. And I will tell you, if you provide the most comprehensive care, it will ultimately turn into revenue, but you need to lead with the proper care that's going to get people better. Don't do it one thing at a time. Look to get your patients better more comprehensively, more quickly, and more happily. Have a great week.